Medicina de Ponta.
Olá, telespectador. Estamos mais uma vez aqui no programa Medicina de Ponta, o qual tem o apoio cultural da Lynx Serviços de Saúde. Como vocês sabem, a Lynx mantém uma rede credenciada de alto padrão, podendo ser o seu passaporte para uma medicina de primeiro mundo. Hoje nós vamos ter um programa um pouco diferente, pois será feito em inglês, com legendas, porque eu estou tendo a honra de receber aqui o Dr. Richard Markoll. O Dr. Richard Markoll, ele desenvolveu toda uma tecnologia revolucionária na Europa, está revolucionando no Canadá e está chegando no Brasil agora uma tecnologia para a regeneração de tecidos articulares, para a regeneração de tecidos ósseos e agora ultimamente tem sido até usada em osteoporose. Ainda está numa fase ainda de inícios de estudos para uso na osteoporose, que são emissão de pulsos eletromagnéticos. Tudo bem, Dr. Richard Markoll? How are you?
Thank you, sir. Thank you for inviting me.
You're welcome. It's an honor for us to have you here. And I'd like to initially to ask you, what is the PST?
PST is pulsed signal therapy. It's a gentle form of treating musculoskeletal disorders, such as osteoarthritis or osteoporosis, injuries, that sort of muscular or joint disorder.
And when did you start working with the PST?
The basic research started in 1969 when I was a student of physics, and in 1973 I began the first pilot studies. Pilot studies are small studies to determine certain outcome measures when looking at effectiveness, applications, and many, many other parameters. In 1976, I then embarked on a large-scale study until 1980. That was almost 1,000 patients. And then we opened various clinics and started serious double-blind studies. At that time, I was a medical officer at Yale University School of Medicine Teaching Hospital, and the hospital gave me a large area within which I treated over 4,800 patients until the early 1990s.
So that's in a period of how many years?
It was a total, with the pilot studies and the completed clinical trials, probably 21 years.
21 years working on that.
But I was a researcher at a medical school, so time was not important.
All right, all right.
I also saw patients in other matters, but that was my hobby, my passion.
And then from then?
Then I had a very interesting patient who came to me. He had a particular lower back, lower spine problem, and his daughter had a knee problem, and they owned a very large piece of property in South Africa, in fact, and he had a big mountain, and he said, "I've never climbed to the top of my mountain, and someone advised me to come to your clinic." And I treated him, and he improved, of course. He was well enough to climb stairs, climb mountains, and his daughter improved. And then he sent his doctor to the United States to be treated, his doctor's daughter, who had a particular childhood musculoskeletal disease. And I treated her, and she improved too. And then they invited me to Germany, and I gave some talks at the Heidelberg University, where in fact this fellow's brother-in-law was chief of rheumatology and orthopedic surgery, Professor Dr. Horst Kotter. And they did some studies at Heidelberg, were quite convinced that PST was effective, and we began opening centers with medical doctors and other colleagues. And that was 1996, in June of 1996 exactly, that we opened the first clinic. And presently, we have more than 750 clinics worldwide and more than 2,000 devices treating patients around the clock.
2,000 devices.
2,000 devices, yes.
So it means that the commercial use of the PST, not I mean commercial, but the use not by research, it started in 1996 exactly in Germany.
June 10th, 1996, we opened the first clinic in Munich, Germany, and we had an immediate success. Then the clinics started to open. I can tell you exactly, by the end of 1996, we had more than 100 clinics. By the end of 1997, we had about 250, and then it just went straight up. Many other countries joined forces. The company became much larger. But I've tried to stay with the research because that's what I enjoy and that's what I understand. And I'm very fortunate now, the last 2 or 3 years, to have some very capable research, one particular research associate. Also we have now another doctor who's young, energetic, and medically and scientifically oriented.
I see. And how does PST works on a joint? How can it help the pulse signal therapy?
The way it works, it's based on the work that I did together with James Weaver and Alan Grudzinski, mainly Alan Grudzinski, at the medical center in Boston, Massachusetts, the Massachusetts Institute of Technology. And what we found out is that when you, if I had a joint, if in any case, if you have a joint and you squeeze it together, what you're doing is forcing the fixed negative charges out of the joint space into the extracellular matrix. For example, with a knee, into the outer
Let's
portion.
put this is a joint. Right,
okay, if this is a joint, if this is the upper leg, and this is the lower leg, just for example, and this is a knee. Now, in the middle of the upper and lower, there is cartilage. That cartilage is fixed as fixed negative charges are concerned. That is, when you squeeze it together, you're forcing these fixed negative charges out into the surrounding area, which is positively charged. And when then you release the compression by walking, for example, then those positive charges are picked up by the negative charges, and you have what's called a streaming potential. Streaming potential is a very clear term in physics. It determines the stimulatory reaction, the regeneration and stimulation, as well as the maintenance and repair of the tissue, works that way. The way PST works is passively doing the same thing. In other words, we induce the PST signal surrounds the joint. It's offered from outside the joint to the joint, and it stimulates the joint to repair itself, to maintain the proper amount of cartilage. For example, if someone has an eye problem, nearsighted, farsighted, something simple.
Say.
What do we do with a pair of glasses? We do nothing but put the signal into the correct perspective. We don't change the eyes.
Exactly.
We don't change the brain. The retina stays.
Just adjust the
Exactly.
optical side.
So what we're doing with PST, we're emulating or mimicking the body's own natural biological physical signal, applying it to the joint, and then the joint understands what to do with the right signal. The same way your radio or your television, if you put the right signal...
What the joint does with the right signal?
With the right signal, it does what it did when it was born. It stimulates good hyaline cartilage or good meniscus tissue or good bone. The reason we're in Brazil at the moment is we were invited to Rio de Janeiro to the IOF, the International Osteoporosis Foundation yearly, it's called the World Conference on Osteoporosis, and we spoke and presented our work with PST, in particular for osteoporosis. Remembering at the beginning we discussed PST is designed for musculoskeletal disorders. Muscle and skeletal include joint arthropathies such as arthrosis, or other traumatically induced problems such as sports type individuals. For example, in Germany, most of the football clubs, soccer clubs, have their own PST facility. The national team for skiing, as well as the national Olympic team, everyone uses PST to stimulate the growth and repair, not only in arthritic joints, also in sports type injuries or in other musculoskeletal problems such as osteoporosis.
Incredible, incredible. Bem, companheiros, vocês veem, no próximo bloco nós vamos continuar falando dentro da área de medicina esportiva, artrose. Você viu que ele citou aí até para as lesões do menisco. Então fique ligado que a gente volta daqui a pouquinho. Olá, telespectador. Estamos de volta aqui no Medicina de Ponta, hoje com um convidado internacional, o Dr. Richard Markoll. Ele que tem formação ele é médico, formado pela Universidade de Cambridge, depois fez no Hospital de John Hopkins, fez um internato em John Hopkins, e depois reumatologia, se formou em reumatologia, e além do mais também tem formação, doutorado em Yale, pós-doutorado na Alemanha em biofísica, e ele descobriu um tipo de terapia que vem sendo estudada há muito tempo, já há 40 anos que vem sendo estudada através de pulsos eletromagnéticos. E revolucionou a medicina na Europa, que começou em 96 o uso mais amplo após mais de 20 anos de pesquisa, e nós estávamos conversando aqui no primeiro bloco de como o PST funciona. Agora nós vamos continuar conversando de que forma o PST age nas articulações. Dr. Markoll, tell me, when a patient does the PST he has osteoarthritis, how long the effect lasts? You know, how...
That's a good question.
What are the benefits?
That's a good question. To start at the beginning, usually the patients that come to us have exhausted the possibilities of other doctors and pharmacology and are still unmanaged. So they come to us and we then treat them. What we usually see is some improvement at the end of the 9 one-hour sessions. PST for a joint is 9 one-hour sessions, usually over a 2-week period, not longer. And at the end of that point in time, we see an improvement in their ability to function. In other words, they regain the activities of daily living that they lost, as well as they have substantially reduced their pain. For example, from severe pain, it goes to mild or moderate or none. It continues to improve for a period of 3 or 6 months. We've completed clinical studies of over 35,000 patients and followed those patients for 1 full year, and they've continued to improve over 1 year. We then did another study where we called back 1,000 patients, 1,000 block. You usually get less, but we called back 1,000, I think 861 returned, to see how many patients still had the lasting benefit from PST after 2.5 years. And we found out that 77% of those patients still had the full benefit. Of the 23% that lost the benefit, we examined them carefully and spoke to them as well as possible, and we found that at least half of them had some form of trauma, accident, slipped on the ice, fell from a tree.
It's more than this 80%. So
right. So it's, in a well-run clinic, you can say that approximately, in studies, at least 80% improve. But you remember in studies, if someone leaves town or is non-compliant, does not return, it's a failure. But in actuality, in a daily practice, you can say that from 10 patients that did not receive relief for any other form of treatment, 9 of those will benefit significantly from PST.
Unbelievable.
And of those 9, after 2.5 years, at least 7 will still have the benefit. The good news is those that might have lost the benefit, and I could explain it in a longer session why they lost the benefit, because it's a continued process of disease or disorder, osteoarthritis is. Those patients with very few additional PST treatments regain the same benefit they had formerly.
Incredible. Does it work the same for knees, hips, shoulders, spine, or is there any difference?
Ostensibly, yes, it's the same, because it's the same diarthrodal joint system, except the back, which is the axial joint system. The difference is the patient comes with different problems. For example, if the patient has a hand arthritis, they say, I can't grip, things fall. If they have a knee arthritis, they say, I can't climb steps. If they have a hip arthritis, they say, I can't get in and out of the bathtub. So basically, the same general level of impairment, depending on the grade of osteoarthritis, but the activity of daily living that they cannot perform while they have their osteoarthritis symptomology is different. The other thing is the pain severity, for example, in knees. Knees is what we've studied most, because as a rheumatologist in a practice, 60% of the patients that walk in the door have a knee problem.
I see.
But all of the joints respond. The short answer, if a patient comes and says, I have a neck problem or a back problem or a lower back or a hand or a wrist or an arm,
now tell me, if like the joint space, if it's too narrow, there's no cartilage, in a case like that, a knee with a heavy arthrosis that I would usually put a prosthesis, a knee arthroplasty, does it help too? But not as much, no?
Let me tell you, it's an interesting point, very interesting. I did these studies with Alfred J. Bullitt, who was the chairman of the National Subspecialty Board of Rheumatology and the chief medical officer at Yale, and he and I found a common interest in basic research in osteoarthritis. And he and I both thought that grade 4 is what you're talking about. Level 4, 1, 2, 3, and 4 would not respond as well. However, we found percentage-wise they responded better or as well as the grade 2 and grade 3. Probably the reason being you don't need a lot of cartilage. In fact, you don't need any cartilage.
No kidding.
To stimulate the growth and repair of cartilage, you need chondrocytes. You need the precursors to cartilage, the cells that develop into cartilage.
But the chondrocytes are in the bone or inside the cartilage?
Chondrocytes are in the extracellular matrix and are waiting to be stimulated. The chondrocytes are part of a presentation that we just completed where we showed the ionic exchange, which is the very basic biophysical level, and then the biochemical expression of that ionic exchange, and then the integration of the biochemical process into a cytoskeletal matrix or expression diagrammatically, and then that's all expressed in lineages. While that sounds somewhat complicated, the simple answer is as long as the patient is alive and has chondrocytes, which everyone does, there is a possibility to help with PST, because most orthopedic surgeons might say that the joint is bald, that it no longer has
no cartilage.
No cartilage. What they really mean, though, if you were to look into that joint, is it has a defect, a cartilage defect. What we did, we did MRI studies before PST and after PST in over 100 patients to visually image what was going on. And you can actually see that this defect is repaired. So it is, in fact, effective. However, the best patients to treat are grade 2 and 3 because they have fewer other problems.
No, yes, that's for sure. But it's a relief mainly for those people who are not in clinical conditions, let's say, to undergo a joint replacement, can benefit from PST instead of taking anti-inflammatory drugs a lot.
Right. The very first patient...
Nephrotoxic and whatever.
Nephrotoxic and hepatotoxic and all of the other problems that the question in rheumatology is when a new drug, is it hepatotoxic or nephrotoxic? No one says, is it toxic or not? Of course it's toxic. The most interesting aspect is we did a large study when Professor Nick Bellamy was in charge of the London orthopedic clinic in London, Ontario, Canada. He had 10,000 patients waiting to receive new hips or hip joint replacement. And when I asked him to study some of them, he said, you can have 1,000. They're all waiting online anyway. And in fact, we said if more than 10% didn't go on to surgery, it would be a good outcome. But in fact, there were 56% decided or did not go to surgery.
You're kidding.
And of the remaining 44%, about half of them, it was interesting, said they're going to surgery for one of two reasons. Because if PST doesn't last a long time, they don't want to get back on the list. Or they said they don't want to disappoint their doctor, so they're going to be sure.
To be sure that it will last. Tell me, in this case, fecha aqui pouquinho. Essa aqui é uma máquina para quadril. In this case, essa é para quadril e para coluna, né? In this case, a person who is receiving the PST sign,
right.
Other organs like the uterus, ovaries, and testicles, the reproductive organs are receiving this sign. This can be of any harm, or the PST only acts in bone, muscles, and joints?
The PST signal is carried on an electromagnetic field. As we know, electromagnetic fields represent 99% of the energy on Earth. So all of the sun signals and all of the other signals around us are carried on electromagnetic fields. This particular signal acts on connective tissue only. Connective tissue consists of cartilage, which is soft connective tissue, consists of meniscus and ligaments, which is dense.
I'm curious because our time is short.
Yes.
Tell me, meniscus lesions, depending on the type of lesions you say, so PST could help repair the meniscal lesions?
The same way that the signal works on cartilage or bone, which is soft and hard connective tissue, it also works in the middle on dense connective tissue, which is meniscus. Everything in the capsule, everything that's connective tissue, can be treated with PST. And I say this because we do a lot of basic research, clinical as well as
several
in vitro studies, and we present 5 or 6 times a year. This particular CD, which is for doctors, has all of the studies on the back, studies over the last 25 years, and we've published, I think we have 16 pages of fine print of presentations and publications, as well as patents. I have 37 patents on various aspects, 3 process patents, the process of treating people with these energy parameters. And at the end of the day, the patient really only wants to know, doctor, will my pain be reduced or not, and will I return to the activities of daily living that I enjoyed, walking, going up steps?
That's all he wants to know.
That's all he wants to know.
And tell me, just such a time short, it's unbelievable. I really would like to keep on talking about this.
I'm looking forward to returning.
A problem that we have in sports medicine very seriously with soccer players, when they kick a ball, for example, then they have a muscle lesion. This muscle transforms to a bone, what we call heterotopic bone.
Right, absolutely.
And this is then you do rehabilitation, the patient starts playing again. He has a lesion at that point, exactly at that point. The PST has application for that too.
Yes, definitely.
To reverse this bone, the heterotopic bone formation.
I'll tell you why. Absolutely, unequivocally, because very simply, PST treats musculoskeletal problems. When these problems occur and they are left alone, you develop an osteoarthritic condition, or at the point of the former lesion, you have a weakness. PST immediately stimulates hyaline, cartilage, or proper musculoskeletal bone connection tissue, the actin and myosin. It works on the very basic elements of the musculoskeletal system. So you have a repair joint. What's very important there is to have proper therapeutic exercise along with the PST. But with sports people, and we have a large number of very famous football players, as I said, and in Germany, the national Olympic team and the ski team.
PSTs.
They all have PST exclusively. Exclusively
for the
right.
team, etc.
I got a call 2-3 weeks ago on a Sunday from the head coach who said, "We need 2 more units in our Frankfurt camp tomorrow. I need them. I don't care what you do," and he hung up. So I sent one of my drivers with 2.
So, and you mean this bone will disappear? It will dissolve, let's say.
The bone, what
The
you see,
heterotopic bone formation.
it's similar to an osteochondrophyte, what we call, what Heberden described in
Nódulos de
1860.
Heberden,
The Heberdenische Knoten. And those nodes are the body's misguided attempt to repair itself. When you put the proper signal on it, like the proper signal to your retina, the body immediately resorbs them and replaces them with proper material. Proper, if it's cartilage or bone or muscle. Again, as we know, one of the 9 systems of the body is the musculoskeletal system. They work together. The muscles cause the bone to develop, and they're integrated.
So it will work also for the rotator cuff
We have
tears.
such great success with rotator cuff tears. It's as well as, yes, sir.
Unbelievable. Well, we are now, hopefully,
seeing
we
is
have it now. Okay. Dr. Markoll, was an honor, really.
My pleasure. I always enjoy coming to Brazil.
It's nice to listen to you, you are the father of the child, we say here in Brazil. You are the father of the child. No one better than you to talk about the PST.
Thank you.
And something doctors usually are skeptical about this.
Justifiably, I was too, but as a physicist, I'm not afraid of medical problems because I'm also an MD, and as an MD, I'm not afraid of the physical problems. So, and as I said, we have a small research team, but they're not afraid of what we're doing either because it's just logical. In closing, the body is an energetic system. We know that. Some people have more energy than the others, and we're an energetic system, no question. So why treat the body with chemicals? We're not a chemical factory.
Let's treat with energy.
Let's treat...
That's it. Okay.
Thank you, sir.
Thank you very much, Dr.
I'm looking
Markoll.
forward to coming back.
É isso aí, gente. Vocês, querendo saber mais detalhes, entre em contato com a gente, www.links.com.br. É um prazer e voltamos na semana que vem. Até mais.
Medicina de Ponta.